everyone, this is Marika and welcome back to another session with me. As we are dealing with the clinical teaching method, we have discussed the first type of clinical teaching method, that is case study, right? Today in this session, we are going to discuss about a clinical teaching method that is quite similar to a case study but has few differences. Now, as discussed in our previous sessions, clinical teaching method in terms of nursing education is very important because it is one of the methods to teach clinical skills to the nursing students. The topic for today's discussion is case presentation. Now, from the term itself, we can make out what is case presentation, right? We do case presentation in nursing education. All of the students are aware about what is a case presentation and what is to be done in a case presentation. Today, let us see in detail how a case presentation is to be made by the students. What are the different features of a case presentation and how is a case study different from a case presentation? A case presentation is an important method of teaching used in nursing education, but in various different healthcare disciplines. So it is one of the very important method that is used to teach in healthcare setting. Okay, so in case presentation, a particular patient is selected, a patient with a special clinical problem or a patient with unique health condition is allotted to each of the student, and the student is supposed to study the patient in detail. Okay, so clinical case presentation is used widely not just in nursing education but in every healthcare discipline in order to make sure that the student learn about the patient or learn clinical skills. All right, in case presentation, a patient with a unique health condition is chosen and it is allotted to each of the students. Okay, so different patients will be allotted to different students and the students are supposed to study the patient in detail, and this study includes the history of the patient, the social, the personal history of the patient, health assessment, diagnostic tests, medical surgical treatments on the patient, the medication that the patient is following, and every detail that is to be included. Everything that has contributed to the present health condition of the patient and everything that is helping the patient to recover, the medical diagnosis of the patient, and what are the various nursing interventions that are provided to the patient in order to help the patient recover. All right. Now, all these details are to be collected by the student who is allotted with the patient. The student studies the patient in detail and then presents it in front of the peer group with or under the supervision of a clinical faculty. All right. Now, from the term itself, we understand a clinical case presentation. To simplify it, a clinical case presentation is when a particular patient or a particular case is taken, allotted to the students. The students are to study the patient in detail and present it in front of their friends or a group of students under the supervision of their clinical instructor. All right. Nursing case presentation, it refers to a formal discussion about a patient. So it is a discussion that is held, it is a formal discussion, and we discuss about a particular chosen patient. Now, this discussion not only includes about the current health status of the patient, as I said, it includes the past social and personal history of the patient, it includes the medical diagnosis of the patient, the health assessment of the patient, various tests conducted for the patient, and it includes basically the most important part in a nursing case presentation are the nursing interventions that are rendered, the nursing interventions that are provided to the patient. Now, all these nursing interventions that are provided to the patient, in this discussion, the problems that are identified in the patient and what are the best possible things or interventions that can be done for the patient to help him recover or to gain his wellness is also discussed. Let us now see the purposes of clinical case presentation. Why is it necessary for the students to study a patient in detail, right? The first purpose of a clinical case presentation is, as discussed in nursing, we are taught about the disease condition first in theoretical classes. Whatever disease condition we study theoretically first. Now the students have the idea of a disease condition, but it is all in theory, right? The students are imagining it. It is all abstract content. What happens when the students are sent for clinical posting? In clinical posting, the students are actually able to see the patient in real. The students are able to see the disease condition that they have studied in real patient. So the first purpose is to provide opportunity for the students to understand a unique health condition in a real patient. So health conditions are studied by the student even in theoretical classes, but then in clinical case presentation, the students are able to study those disease condition, a unique disease condition in a real patient. All right. The next purpose is it helps the student to actually relate or compare what they see in the real patient with the existing literature. Again, as I said, the students are taught about all the disease condition in theoretical classes first, right? The students have the detailed idea about a particular disease condition, but all in theory. Now, when we compare our theoretical aspect with practical aspect, there are obviously chances that there will be differences in what we see in a real patient and what we actually study through book. Through clinical case presentation, opportunities are provided for the students to compare the actual clinical presentation of the patient with the existing literature. It facilitates the student in development of assessment skills, writing and presentation skills. The students get the opportunity to actually express themselves through writing. They can actually show their writing skills, as well as they get the opportunity to speak in front of large group of people and showcase their presentation skills. The next important purpose of a case presentation is it helps the entire group of students to actually study about a case which they are not allotted with. As I said, in a clinical case presentation, the student who's allotted with a particular disease condition will present it in front of a group of his friends under the supervision of a clinical faculty. So case presentation actually gives the group of students to have an idea about a case or about a clinical condition which they are not allotted with. If we give one condition to a particular student, the student obviously will study it in detail. But the student, if they do not have presentation in front of their group of friends, they will not be able to know about different cases available in the ward or in the hospital. Now here in case presentation, the students are getting the opportunity to actually be there and listen to other unique case condition which they are not allotted with. They are getting idea about the particular condition. Also, they're getting to know in detail about each of the patient and their health status. All right. Now let us see the process of a clinical case presentation. So the first step includes selection of the patient who has a unique health condition. Next one, once the students are allotted with their patients, the student have to collect information and data regarding the patient. So the second step involves collection of data regarding the health assessment, the diagnosis, the treatment, medical surgical treatment, the reports, the test, and the progress of the patient. Now, how will the students collect the data? The students may collect the data from the reports of the patient which is already written by a healthcare team member, right? The students might get the case sheet of the patient from which they can actually refer and collect all the information from. The first one is referring to the case sheet of the patient. The second one, the student can also collect some of the information through observation. They can actually observe what is happening, how the progress of the patient is going on, what are the various nursing interventions that are done, how useful are those nursing interventions, what are the medication that the patient is taking, and what are the various assessment that is conducted on the patient. Okay. The first one is by referring the case sheet of the patient. The second one is by observation, and the third one is through first-hand information. Okay. In the first step, the patients are allotted to each of the student. The patient with unique health conditions are allotted. In the second step, the students are supposed to collect the data. They can collect the data through three ways, that is from first-hand information, or through observation, or through the case sheet that is already written by the healthcare team members providing care to the particular patient. The next step involves comparing the actual patient picture with the existing literature. What we see in actual patient is obviously different from what is taught theoretically. Every patient may have different symptoms and it may vary in severity as well. So in the third step, the students are supposed to compare the book picture with the patient's picture. And finally, once the student have collected the proper information and has compared the book picture with the patient picture, the student can write down a report or a case presentation. Now, once it is written clearly, which includes all the information that is required to be included in a case presentation, the particular student can present the case to the group of students, to the peer group, with the supervision of a clinical faculty. Now, while the student is presenting a particular topic, the peer group or the members who are involved in the case presentation may have certain doubts and are given the opportunity to actually ask questions to the presenter. And finally, the supervisor, that is the clinical instructor who is there, does the debriefing of the case and clarify the doubts of the group if not clarified by the presenter. Okay, so these are the various processes involved in a clinical case presentation. First, a particular patient is selected and then the students are allotted with each of the patient. The students are supposed to collect the information about the patient that is required to complete a case presentation. The information collected may be the first-hand information, it may be through observation, or it may also be by referring certain case sheet that are made by the head team members. Now, once all the information are collected, the students are supposed to compare the patient picture with the book picture. Once the comparison is done, the student can write down the report or a case presentation. The assigned student is supposed to present the case in front of the peer group. The peer group then listens to the entire presentation and if they have any doubt can ask their doubts. Once this is done, the supervisor, who is the clinical instructor, is supposed to do the debriefing of the case so that all the doubts are cleared. And if the students have any doubts which was asked to the presenter and the presenter was not able to clarify, the clinical instructor can clarify the doubt of the peer group. Moving on, let us see what are the advantages of a clinical case presentation. The first one is it provides the opportunities for the nursing students to understand a particular disease condition and also to understand the nursing interventions that are needed for the patient to recover. Right? As we have been saying from the beginning, this is actually done in order to make sure that the students see and understand how it is in actual patient, how a particular disease affects the patient, what are the symptoms that are shown by the patient, right? So it provides opportunity for the students to actually see it in a real patient. The next one, as it is a case presentation, it provides the opportunity for the students to actually speak in a group and also to clarify the doubt of the peer group. Here, in case presentation, the students also get the opportunity to correlate or integrate the knowledge of various different subjects like anatomy and physiology, pharmacology, pathology, microbiology. They also get to correlate medical, surgical, and nursing intervention. Next one, students get the opportunity to correlate the disease condition in the real patient and in the literature. As I have been saying, we study everything theoretically first in nursing, right? Then after, the students are exposed to a real patient or a clinical setup. So the students get the opportunity to actually compare what is written in the book, how much it is similar to the patient's case or how much it is different from the book picture. So these are the various advantages of a clinical case presentation. It provides the opportunities for the students to speak in group and also to clarify the doubts of their peer group. It provides the opportunity for the student to actually see a real unique clinical condition in the real patient. Gives the opportunity for the student to compare the actual patient picture with the book picture. The students also get the opportunity to integrate the knowledge from various different subjects like anatomy, physiology, pathology, pharmacology, microbiology, nursing, and medical surgical interventions as well. Moving on, we have disadvantages. Even though we have various advantages, there are few disadvantages of a case presentation. Now, as I'm saying presentation, the particular student is supposed to present a particular topic in front of a group of students, and there is also clinical instructors involved. Now, for a presentation to happen properly or a presentation to be a successful one, the student who's presenting must be resourceful, must have a proper knowledge about the patient, and also should have the skills of presentation, right? Good command over their language, expression, how to start, how to speak, how to use the voice, and everything must be taken care by the student so that the presentation is effective and achieves desired result. In the absence of all these qualities in a particular student, the clinical teaching method may not be very effective. And the next disadvantage is that it is difficult to get an ideal patient for the case presentation, and also to take a case presentation and do it properly without bothering the patient much for this particular purpose. Obviously, to collect information, obviously to collect the data and collect information, we have to go to the patient, talk to the patient, right? We have to ask about various history about the patient, which the patient might not like. This might bother the patient. All the patients might not be cooperative with the student as well. So it is difficult to get ideal patient for a particular case presentation sometimes. These are the advantages and disadvantages of clinical case presentation. To conclude, today we have seen what is a case presentation, what is the process of clinical case presentation, and various advantages and disadvantages of clinical case presentation. So a case presentation is a process in which the students, especially in healthcare discipline, are allotted with a particular patient who has a unique health condition. The student has to study the patient in detail regarding the past, present history of the patient, personal and social history of the patient, medical diagnosis of the patient, medical and surgical treatment of the patient, nursing interventions that are rendered to the patient. Present it in front of his peer group under the supervision of a clinical instructor. Now, a case presentation will help the student to have a proper knowledge about a particular disease condition on the real patient. It will also help the students to actually compare what is studied theoretically, the book picture, to the real patient picture. It will provide them opportunities to also speak in front of a public and also answer to the questions raised by their peer group. It also facilitates the development of assessment skills, writing skills, and presentation skills of the students. And it also helps to orient the entire group of students with every different type of clinical case. We also discussed about the process, which includes allotment of the patient, gathering the data and presenting it in front of their peer group, and summarizing the entire case presentation. That is all for case presentation. I hope the class was helpful, and I'll see you all in the next session where we will be discussing about nursing rounds. Thank you and have a great day.